Welcome back to Heathy Living, brought to you by Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about a community advisory council focused on a healthier North Shore. We talked first with Ann Pavlovich, who is heading up the council, and we will speak with two other members of the council. Next is Dr. Michael Hill, who works with Tammany Health System in the executive team. His focus is on population health, quality, and utilization management. Dr. Hill, welcome. We're so glad you could join us.
Thank you, Melissa. It's great to be here.
It is, isn't it? Back in the studio in person.
Yes, it is.
We're doing our part with our masks and social distance. We're talking today about the advisory council that is focused on healthier North Shore. And I know I talked a little bit in the first segment of the show about how people think of hospitals as where to go when you're sick, but we really have a duty and a responsibility in our community. We say we're the heartbeat of our community, and we really mean that. So can you talk a little bit about the challenges our community faces in terms of chronic disease and just general health status?
Sure. So as you said, we've been used to treating people when they get sick, and I think Tammany Health System really is being proactive and starting to work with our population and our patients in on prevention. Like Ann said, we spend way too much on health care in our country, and a lot of it is because we're reacting to things that are happening now. And what we want to start doing is focusing on managing chronic diseases and things that set people up for poor outcomes later in life. So the earlier we can get to folks, and the earlier we can do screenings, and the earlier we can do preventive things with lifestyle changes such as exercise and diet and those sorts of things, and good eating habits and reduction in alcohol consumption and doing away with smoking, we'll have better outcomes both in chronic conditions and in cancer. You know, our leading cause of death in our two parishes, Washington Parish and St. Tammany, are heart disease and cancer, and those are directly affected by those variables we just talked about.
Right, and I think heart disease, a perfect example, we can look at Washington Parish and St. Tammany Parish and see a significant amount of heart disease. And then, as you said, cancer. We have a wonderful coalition of cancer professionals in St. Tammany Cancer Center, and we know that our partner Ochsner Health and St. Tammany Health System are building a whole new building, but that aspect of it has a lot to do with the care once someone has a diagnosis.
Right.
So if we can reach out into the community, if we can go do some early screenings. So for example, we know that breast cancer, when found early, is very much a survivable experience. And lung cancer, which is one of the diseases that often isn't found early, we have a special program for that. Right,
we do. We have a few things I want to say because you brought up some really important points. One of the things that we found is too often here in our parish, in Washington Parish, we have people who are diagnosed too late. The earlier you can get diagnosed with a cancer, usually in most cases, the better the outcome. And too often people are waiting too late to get screened. And that's why screening is so important. And not just screening once, but routine screening either every other year. For colorectal screening, it's a colonoscopy every 10 years, unless you have certain conditions, and then it's more often. You mentioned mammography, very important screening for breast cancer. We have low radiation CT for screening for lung cancer in patients that are at risk. And these are all important things to detect changes early so that we can treat early and have better outcomes. As I said, too often we're getting people in the later stages of cancer, and it's much harder to treat those patients and to have good outcomes.
Okay, thank you for that. And you know, that all of that focus is very much on being proactive, getting that screening, going to the screening or having the screening come to you. Mm-hmm. But a lot of folks, I think we have a tendency to be a little bit of, if it ain't broke, don't fix it. If I don't go to the doctor, nothing could be wrong with me, I'm not hurting. But almost all of us with an insurance plan probably have some sort of a wellness component, and I bet a lot of us aren't using that.
Right, and every plan varies, but a lot of plans have very low deductible payments or no payment for wellness visits or for screening. And so the other area is heart disease, which is affected by hypertension and diabetes and obesity. And those are things that we can change. If we can change early in life, we can prevent those early cardiac deaths that we see, in our community. So it really is a lifestyle change. We know that if you affect some of these things early in lifestyle and do your annual screenings and see your physician or provider early and often, at least once a year, we're going to have better outcomes. And our goal really is, believe it or not, is to keep people out of the hospital, to have a healthy community, to move Louisiana up in the standings in both decrease cancer deaths and heart-related deaths.
Wonderful. Well, and it's interesting, we're sitting here talking about these long-term chronic diseases that our North Shore community has dealt with forever: heart disease, diabetes, cancer, but we have a brand new one we're having to deal with now, a worldwide pandemic, COVID-19, and it is right here on the North Shore. Can you talk to us a little bit about how that's affecting our population?
Sure. I think we saw early on that when we had some increased cases, that people were nervous about going to the doctor or going to the hospital, even if they had symptoms. And we had some significant cases of people that delayed care to their detriment. We've had a couple of cases of people with heart attacks that they had at home and waited several days to come into the hospital, and that really causes a lot of damage to the heart and a poorer outcome for those patients. So we really want to encourage people to, number one, continue to meet with their providers, whether it's in a virtual visit if they don't feel comfortable going to the office, or coming into the office for a face-to-face visit. I can say that we take very good care at St. Tammany Health, and I know Oxford Health does the same thing in having patients come in. They can wait in their car and come in straight to the visit. They can also do a virtual visit if they don't feel comfortable coming into the office. And if they have an acute symptom, come to the hospital. It's safe. The big message is our emergency room is safe. We take very good precautions. The hospital probably is one of the safest places you can go now, and there is really zero risk of catching COVID going into the emergency room if you wear a mask, if you do social distancing and do good hand washing. And we do all those things at St. Tammany Health System, and Oxford Health does the same thing. So we feel very comfortable about having patients come into our healthcare facilities or our clinics.
Fantastic. And would you say, I think, what you're talking about is what we're experiencing today as people are sort of weighing how they feel about COVID and what their comfort level is, because it is here and it's been here for 6 months. Would you say that some of what we're experiencing with the human reaction to COVID has to do with all of our comorbid conditions?
Sure. And we've seen poorer outcomes in Louisiana because of the health conditions of our patients. We know that patients who are obese have a higher mortality rate with COVID. Patients who have heart disease or lung disease may have more difficulty when a respiratory component comes in with COVID-19. So certainly underlying health condition really does kind of portend to an outcome in patients who have serious effects from COVID-19.
Got it. Well then, what would you say we should all be doing to protect ourselves from COVID? Wear a mask.
Wear a mask. Socially distance if possible. No large crowds. So, I mean, really and truly, when we've seen super spreader events, it's large crowds getting together. It only takes one person in that crowd to be infected, and we know that about a third of patients with COVID are asymptomatic and will shed virus. And the other thing is good hand washing. So, soap and water, preferable for 20 seconds. If you don't have water, hand sanitizer when you can. And I think, again, continue to work on your health. Don't neglect your health. Don't neglect your mental health during this time. So I think it's important to do those things.
Well, thank you for that. And actually, mental health, Nick Richard is going to be talking with us next about that component. So thank you for that.
Wonderful.
Really appreciate you coming in, Dr. Hill.
Well, thank you, Melissa. Good to be here.